Um, in 2018.
Brian, pull that microphone up to your face a little bit. There you go.
How's that?
Perfect.
All right. In 2018, individuals by the name of Amber and Marcus Capone founded an organization called VETS, Veterans Exploring Treatment Solutions. Marcus Capone had been a special operator, and he had done multiple tours in both Afghanistan and Iraq. When he came home, finally from war, Amber described an individual who bore no resemblance to the man that she married. He came home as a severely traumatized individual and was met by a system which could not in any way effectively address the nature of his trauma. Recognizing that his life was at stake, as well as the future of her family, she became desperate and went online and discovered the existence of a compound called Ibogaine. She made arrangements for Marcus to receive treatment from an individual by the name of Martine Polanco, who operated a clinical operation called Mission Within. Amber, as a last shot at saving her family, sent him to Mexico to receive Ibogaine treatment. She said when he returned, he came back as the man she remembered marrying before he ever went to war. As they learned about other friends of theirs who were coming back home with similar circumstances on the verge of familial dissolution, with Marcus and his friends at the verge of suicide, they began just as a friend group to put money together to send their close circle of individuals down to receive this treatment. They came together to form VETS, and since 2018, over 1,000 veterans have traveled to the Ambio Clinic south of Tijuana to receive Ibogaine treatment for symptoms of traumatic brain injury and post-traumatic stress disorder. Because of the miraculous outcomes which were endorsed by the veterans who were receiving this treatment, a group of philanthropists funded a study out of Stanford University, which was led by Dr. Nolan Williams. And over the course of several years, a cohort of 30 veterans were evaluated before and after Ibogaine treatment. They were evaluated comprehensively through the administration of a battery of psychological tests to quantify the nature and duration of their symptoms. They underwent pre- and post-treatment MRI scans. These scans were compared against a database which had been compiled of hundreds of thousands of healthy adult brains covering the human lifespan. And through an algorithmic assessment, the question was, what was the physiological effect upon the human brain, if any? To explain these miraculous outcomes were veterans who had been on the verge of suicide, who had been paralyzed by symptomatology associated with profound anxiety, profound depression. In many cases, veterans who were prescribed an array of habituating pharmacology which ineffectively addressed their symptomatology were not just back to what they could remember being before they experienced their trauma, but had been liberated from that pharmacology. The results of that study are nothing short of miraculous when it comes to the way in which Ibogaine has been revealed to have significant neuroregenerative properties that impact the human brain, with profound implications for conditions for which there are no current effective treatments. Specifically, the white matter that covers the surface of our brains, which is the highway across which all of our thoughts and impulses travel, grew and thickened in size across the entire surface of each of these veterans' brains. The centers of the brain responsible for emotional regulation and executive functioning grew in size. The average reversal of brain age among this cohort of 30 veterans was 1.5 years, with the top 5 among that cohort seeing a reversal of brain age of almost 5 years. Right now, there are individuals who live offshore from the United States who are using Ibogaine to effectively treat symptoms associated with multiple sclerosis, Lyme disease, and Parkinson's disease.